these skills, or these muscles. Okay, if somebody's a bodybuilder, they're going to build upper body. So how you use your system changes your system. So when the doctor compensates by giving somebody a pair of eyeglasses, but my system continues to over-focus, we've addressed the smoke, but we haven't put out the fire.
Okay, I have another question for you. So in the example with the Paris and the in, right, being there twice, for us, as we're listening to students who are reading, oftentimes, like, obviously we count that as a mistake because they didn't read something correctly, but we do have kind of stronger readers who do that a lot. What are your thoughts on that? Is that a vision sort of thing?
That's vision as opposed to sight.
Processing.
Yeah. Yeah, and those are things that somebody can learn how to use their two eyes together as a team. If I can't fuse the two images, okay? So again, if I have one hand here and one hand here, I can see both hands. So which one should I concentrate on, this one or this one? Okay? Well, this one is actually confusing me, okay? And I have to expend energy and effort to turn this one off. And if I don't turn it off, I'm actually seeing two, and that's confusing.
But it shouldn't be confusing as a reader, right? Because sort of as a reader, you are reading this word, but your brain is already getting ready for that next word because it sees it, right?
It should.
So you don't really want them to not notice that word ever.
You want them to notice the word that's going to be the next word or phrase to their right, or when they get to the end of one sentence, you want them to notice how far do I have to move my eyes to the left. You certainly want to do that, and that's that central peripheral that you have to be able to integrate.
All right, then I have one more question. I'm sure somebody else is going to ask other questions. So you mentioned very briefly the tracking with the finger. Is that something that is helpful to develop those vision skills? Obviously you want it to fade eventually, but should we be using that with 5- and 6-year-olds and then?
You can, okay, because they're still at rudimentary levels. It's kind of like at that person that's still doing this, okay? They're at a lower level. Okay, you want to get them to the point where they're no longer doing this, but now getting to do this, or hopefully just doing this, eyes free of the body.
So, talk about like the precursors to reading.
Rebecca.
Rachel.
Rachel.
So when you
guys
have,
had to sit next to me.
so when you have a child present to you with like a learning difficulty, reading difficulty, you obviously do one of these assessments. I mean, is it typical that it's an issue with all 4 of these things, or is it like typically that's one affected thing?
You're talking about?
The precursors, like their inability to fixate. I mean, do they develop one after the other? Do they all develop at the same time, or?
They should concur, okay? So somebody may have more of a problem in terms of convergence, or in terms of over-accommodating or under-accommodating. So it doesn't necessarily have to be all of those. A child with, on the autism scale, for example, okay, they may have difficulty in fixating, okay? They're looking all over the place. And you've got other kids that dad gives them their cell phone and they're super fixated or hyper fixated, and they can't attend to anything out here. So they use either their central system or their peripheral system, but they can't integrate. So I wouldn't say it's 25, 25, 25, 25. No, it might be 50, it might be 10, it might be 30.
And so, like I would do like that ocular motility assessment, like doing the tracking, whatever. What does that tell me in terms of like those precursors?
That tells me developmental age. Okay, has somebody developed the visual skills? Usually by 5.5 to 6.5. I should be able to move my eyes separate from my body, okay? And I have to have that in order to be an effective reader.
I think kind of piggybacking off that, Katie. So do any of those websites or anything you shared have any sort of like if-then type things? Like if we notice that they are doing that, there are some exercises so is that where we would look for things like that?
Yeah.
Okay.
And a lot of this is, well, I don't like calling it exercise because people think of exercise as kind of like weights.
Okay.
These are more mental as opposed to physical.
Got
Okay?
it,
Because this controls this.
got it.
Vicky,
Good.
if a child is diagnosed and they go to you for therapy, what does that look like?
Therapy is typically done once a week in our office. It's done for an hour. They go home and they do home activities for about 20 minutes on the days that they're not in therapy. So it's kind of like the equivalent of learning how to play the piano. I go in for the lesson, and I have to go home and do what? I've got to practice, and I'm sure your students as well. You send them home, and I want you to practice this, so that it becomes second nature. So the next week they can come back and you can go to the next level.
How long do they stay with you for? Not per week, but months, years?
Typically, it could range, if it's a learning-related vision problem, it could be about 9 months sometimes. Okay, if it's strabismus or amblyopia, that might take a little bit longer. If somebody has, if somebody's doing well in school, it might take more like 4 months.
Is it covered by insurance?
Typically not, okay, because insurance usually covers, they have a criteria, medical criteria of injury, illness, or disease, okay? That's what medical insurance covers. When it's not something like that, and if it's something that's educational, the medical insurance says, hey, not our problem, okay? This doesn't fall within our definition of medical necessity. I've got car insurance, okay? I'm sure most of you do as well. But my car insurance doesn't pay for my gas. It doesn't pay for my oil change, it doesn't pay for my tires, okay? If I need a muffler to be changed, sorry, okay? So even though I have auto insurance, doesn't assure it's gonna cover everything. And people want that, I mean, obviously. We want medical insurance to cover everything. But my child has headaches. Well, these are their rules, okay? And they say jump, we have to say how high.
I actually have 2 questions. So if a teacher was talking to a parent and said, you know, your child's having difficulties with reading, and the parent's like, yeah, I noticed the same things, and the teacher says, well, did you get their eyes and their ears checked? And the parent says, yeah, 20/20 vision. Is there something that a parent should be saying to the eye doctor, like, to have these tests performed? Because typically an eye doctor wouldn't do that, correct?
Correct.
So what do we?
Most eye doctors are looking at one eye,
Right,
and they're
so
looking at the other eye.
should we be saying something specific to
Well,
an eye doctor?
they should see somebody who's a developmental optometrist. And unfortunately, in our state, we probably have 25. Okay, there's a number of them even within our circle. Okay, even within a radius of, let's say, 20 miles from East Brunswick, you probably have, we all know each other, so I would figure there's probably 6 or 7 at least.
Okay, and my other question is, and I don't know I'm thinking of a student in particular, and in 1st grade, she was diagnosed with having seizures. I can't remember what they're called. Like her eyes would just go up, and she was, went to a neurologist, and she is now on medication. But she is significantly behind, almost 2 years behind academically, right? So she's a 3rd grader reading on a 1st grade level. Is this something that maybe she just didn't develop because, and now is this something I wanna say to the parent is like, help me, what can I do? I don't think that she has a learning disability. I think she just she's playing catch up, and
Right.
now the gap is getting bigger and bigger and bigger
Right.
because she's getting older, and she's shutting down because she can't do
It's
it.
an arm tied behind
Yeah,
your back.
so I'm
The
curious
reason-
if
The
that
reason we're
might-
talking about is school. I'm competing against the other students, I'm competing against myself, okay? I want to be able to get through. So the intent here is, what can we do to help this person release their hands so that they can start to function better? The analogy is, what can we do to help this person gain the skills, put the tools in their toolbox, so now they can do what they want to be able to do. We not only have to have the hammer and the screwdriver and the pliers, but we also have to show them how to use them. And if you're missing 1 or 2 or 3 of those skills, then it makes it a lot more difficult for them to succeed.
Right, so that could be the issue, right?
Yeah.
So that would be something that they could look into.
And again, just like learning how to play the piano or tennis or driving a car, these are learnable skills, okay? And once you have the ability to drive a car, you can drive any car, okay? You can rent a car, you can buy a car, you can borrow a car, you can use your husband's car. The point here is that these skills, once you gain them, you own them. Good question.
I just had a question, that reminded me of, we'll ask that, the tracking behind, I have a couple students students who, when they're reading, like, will skip like 2 or 3 lines, so I've given them like a reading tracker, if you see it, where it's like part that's like clear
Sure.
colored, and then it's like gray and gray on the top and the bottom, and they're
Right.
using that, but
Because
is that
what
like a
they're,
helpful tool to you,
yeah,
to give them?
certainly, and it's kind of like if somebody broke their foot, okay? I can just jump around, or I can use a pair of crutches, and that's a pair of crutches essentially. So here what you're doing is you're trying to eliminate a lot of the extraneous information and help them so that they're not very peripheral, and that you're kind of corralling them into being a lot more central. So yeah, it's a good tool, okay? Just like using your finger initially is a good tool, but you want to be able to graduate out of that, okay? It's kind of like once, like, okay, now I know how to add numbers, okay? That's good, but now you need to know how to subtract, and now that's good, okay, now you need to know how to multiply, and how to divide, and how to do fractions and decimals, and because ultimately, you may need to do algebra, or trigonometry, or calculus. So you want to put the tools in their toolbox.
So to go along with that question then, are there things that we as educators in a school can do to help them get rid of that crutch, right? Like, are there things that we can be teaching them or practicing with them to do to help them become more independent trackers?
Part of what you can do is identify the problem and appropriately refer. In the same way that Dr. Kellerman had a talk with Nicole and appropriately referred for this type of talk, okay? When I see somebody who needs cataract surgery, I can follow them to a point and then, gee, now you need cataract surgery. I'm sending you to a subspecialist who does a lot of cataract surgery. He does cataract surgery in his sleep, okay? He does it so well, okay, and the patient comes back to me the following day so that we can monitor how they're progressing. But I can't do cataract surgery. It's not that I'm an unqualified doctor, it's that he's got this subspecialty area, okay? So I have to appropriately diagnose that this person has a cataract that warrants surgery. And in the same way that whether it's an OT or PT or reading specialist or whomever, okay, needs to be able to identify, well, this person has an underlying problem that's impeding their ability to read.
I don't know if this is a silly
Katie.
question, yes, but this is where my brain's going. Like, what percentage of the kids that you see and treat are dyslexic, or like, what's like the correlation, if any, or is it an isolated thing? Does that make sense, what I'm asking?
This means not, lex, read. Okay, so
Right.
dyslexia literally means that they're not able to read.
Right.
What I find is many kids who've been diagnosed with ADD or dyslexia or learning disability, not all, but probably a good 70 to 80% have an underlying vision issue. Okay, solve the vision issue,
Yeah.
and you put the tools in their toolbox, and yeah, they may still have
Yeah.
residual issues,
It makes sense.
but it
Yeah.
makes it a lot easier for them to be able to function and learn.
Makes sense, yeah.
I have 2 questions. So if we suspect a child has like a tracking or convergence issue, this is like the number that we would refer them to? Okay, excellent. And the second question is, so. My second question is, so, a lot of the warning signs are similar to like a reading disability, right? But dyslexia is like phonological, so like auditory like in nature, right? So would you recommend that we like have this like ruled out, like their visual ruled out before, like, I don't know what my question
So
is.
I
but-
think I'm gonna answer that for you,
Okay.
because right, one of the things I think we're all thinking is like, can you come be an employee here?